Nephrolithiasis or kidney stones are an aggregation of hard crystalline substances that form within the kidney. The development of these stones is multifactorial with many contributions such as genetics and lifestyle. Approximately 1 in 11 people will develop kidney stones in their lifetime. Ureteroscopic laser lithotripsy is a widely used method of removing kidney stones. During a procedure, the laser is used to fragment the stone into smaller pieces, or it is known as dusting, where these fragments get to the point that they are small enough that they may pass spontaneously through the urine. Otherwise, a basket catheter can be inserted to remove larger pieces. However, as stones are fragmented, they may scatter and be potentially unretrievable, getting caught in hard to reach spots due to the unique anatomical structure of the kidney. These uncleared fragments predispose to stone recurrence, leading to infection, pain, and obstruction within the kidney. Developing a method is vital to improving patient outcomes and preventing future complications. With the current retreatment rate of 20.1%, it is our goal to help identify a means to reduce post-lithotripsy stone fragments. Part of our proposed solution is to use a hydrogel made of an inversely thermodynamic material, meaning that it would be administered as a liquid, and then at warmer body temperatures, it would solidify to a gel-like substance. It could then be flushed from the system using a cold liquid such as saline. The gel is translucent and would allow the surgeon to maintain visualization of the stone and refocus the laser and reduce larger fragments to smaller sizes. The question we wanted to answer was if it would be possible to push the gel through a catheter as a liquid and then have it solidify at body temperature.
We kept the hydrogel in an ice water bath to maintain its liquid form, as well as the guide wires in a separate ice water bath. A standard 5 French catheter was used in this experiment and was passed through a warm water bath, which was maintained at body temperature with a sous vide device. 5 milliliters of the gel was loaded into a syringe and pushed through the catheter, where the gel was caught in a plastic beaker on the other side. The catheter was used either with or without a cooled wire, which was our active cooling method. To the bottom right, you can see a basic visual representation of our experimental setup. After doing 3 trials with the experimental or guide wire catheter and 3 with the control that had no guide wire, we used an unpaired equal variance student's t-test to find any significant difference. We hypothesized that the cooled wire in the catheter would improve gel delivery to the renal pelvis. Because of its inverse thermosensitive properties, we were concerned that it would solidify while being passed through the catheter, and the cooled wire would prevent that. However, our results show that there is no significant difference between both groups, indicating that the time it takes to deliver the gel to the renal pelvis is roughly the same with or without a guide wire. Additionally, the wire was somewhat obstructive and made the gel more difficult to push through, and these results indicate that a wire-free approach is equally effective while also more mechanically feasible.
While a proposed cooled catheter approach performed no better than the standard catheter, this is actually a good thing. It means that there's no need for active cooling. Instead, we can simply keep the gel in an ice bath until it is used. It also means the surgeons can administer the gel using the same catheter that they currently use. Ultimately, our experiments demonstrate that we can administer our gel without changing much from the standard lithotripsy procedure, decreasing the barrier of entry. Before starting development and experimentation, we performed a literature review to determine if there were already solutions out there. We came across several papers, 2 of which we included here. The first, which was published in 2012, examined the current approaches and concluded further efforts are still required to produce a safe and effective anti-retropulsion device with lower retropulsion rates. The second paper, which was published in 2020, arrived at a similar conclusion. In their closing remarks, the paper said the ideal device should 1, be easy to place, 2, overcome fragment migration, and 3, must be cost effective. These were the goals that we set out to achieve at the onset of our project, and we believe that our prototype addresses all of these. For our future steps, we plan on conducting more trials as soon as we get more gel from our supplier. Additionally, we would like to make a few changes to better understand the thermodynamic properties of the gel. After finishing the wet lab experiments, we would like to move into in vivo testing, which will more closely mimic a real clinical scenario. This will tell us more about the hydrogel's behavior and the mechanics of its administration. Long-term, we plan on performing clinical trials that will demonstrate the gel's safety and effectiveness to real patients. Thank you.